Hello everyone, my name is Elena.
My name is Huailan.
I'm Katie. I'm Jennifer.
So today we'll be talking about the health and safety of hepatitis B. Here is an overview of the presentation. To start off, what is hepatitis B? Hepatitis B is a virus that attacks the liver and can lead to chronic or acute infections. It is acute when it's first infected, and most don't have symptoms and get off the virus without any medications. Others will have chronic infection if they're unable to get rid of it over 6 months. There's an estimated of 257 million people living with the disease worldwide. The reason it is so important for educators to know about a virus is because infants and children are most vulnerable to getting chronic infections. Therefore, a prevention strategy is for infants to receive the hepatitis B vaccine as soon as possible after birth.
Young children and people with acute hepatitis B do not present symptoms. Older children and people with chronic hepatitis B present symptoms including fatigue, a low-grade fever, nausea, vomiting, dark urine, appetite loss, and jaundice, which is the yellowing of the skin and eyes. Hepatitis B can be detected after 30 to 60 days. Hepatitis B is transmitted through unprotected sex, from a mother to an infant, infected blood, and contaminated needles. Hepatitis B can survive 7 days outside of the human body and can be passed through the mucous membrane or through an open wound.
Vaccines are important because they have prevented countless cases of diseases and saved millions of lives. All children should get their first dose of hepatitis B vaccine at birth and should have completed the vaccine series by 6 through 18 months of age. Children and adolescents through 18 years of age who did not get the vaccine when they were younger should also be vaccinated. Then, who is at risk for hepatitis B? Healthcare workers, people who use IV drugs, people who have kidney disease, people who have chronic liver disease, people who have multiple sex partners.
Vaccine. The most common way Hep B would be transferred in a child care setting is through blood. Therefore, it is important that educators are always following correct procedures and wearing personal protective equipment like disposable gloves when cleaning up blood or bodily fluids. Educators can also tell children not to touch anyone else's blood or let anyone else touch theirs. They must also carefully disinfect any furniture, toys, or carpet that may have come in contact with blood. Careful storage of supplies or personal items like toothbrushes also reduces the chance of spread to others.
What to do if a child gets the infection? Prevention is the best way to avoid infection. That is why transmission of hepatitis B is rare. Children are at risk of hepatitis B if another person's bodily fluid enters their eyes, nose, or mouth, or if a bite breaks the skin. If fluid is suspected of entering these areas, it is recommended to thoroughly wash it with water. If a bite breaks the skin, it is recommended for educators to contact their local public health unit, as blood tests may be needed to ensure there is no infection. There is a no exclusion policy for children or staff with hepatitis B. If a child is suspected of being exposed to the Hep B infection at the center, consulting the physician is recommended, especially if the child has not been immunized against hepatitis B.
If the child has hepatitis B, everyone else in the family should get the shot. Parents should not share personal items that may have traces of blood on them, like toothbrush, nail clippers, or scissors. If the child with hepatitis B is bleeding, be careful not to touch his or her blood or any blood-tinged body fluids unless everyone else is immune. The child and the rest of the family can safely use the same eating sets. No risk of passing the virus to others by sneezing and coughing around other people, hugging and kisses.
Thank you for listening to our presentation.